Okay, so welcome everyone to the NCIMS sneak peek video with Dr. Patterson. We are here to kind of just give us a little intro in what we are going to expect from your talk. And I love the fact that we have you speaking this year because Lyme disease is near and dear to my heart with having family members. And I know some of us may even had it ourselves. And so we get into this realm, but I'd really like to just hear how you got into this space, knowing that you're in Connecticut, so you're actually kind of in ground zero. But if there was any other reason why you got into it, and just kind of give us a little bit brief intro into how you got into it and your talk. And for those of you who have not had the pleasure of being able to hear you speak or read some of your books, I'd really love to just know a little bit more about you.
Yeah, definitely. So, yes, Connecticut is ground zero of where Lyme was actually found and diagnosed. But one of the things I will talk about in my talk is it's really throughout the country. It's rampant in the country, and there's different subspecies that may get worked up or not. And so, my background, just to know a little bit about me, I'm a nationally recognized naturopathic physician. I'm an Amazon bestselling author, success coach, Forbes contributor, and I present a lot for different nutraceutical companies and agencies and functional medicine doctors to discuss oftentimes autoimmune conditions and Lyme disease. And so what I'm excited to do in this talk is going to be bridging the gap between things like tick-borne illnesses and how they can be precipitating factors for autoimmune conditions. I myself had Lyme disease several times. I had Bartonella, which is a common tick-borne infection. I also had Babesia, and I actually had it when I was in naturopathic medical school. And I learned more about it after I was out and practicing and started seeing patients with Lyme disease. And I was like, wait a second, these are many of the things I had, during that time.
Yeah.
So I went back myself, got tested, and I was clearly positive, even IgM positive at that time. So I went through my own experience. I've had family members like you that have had Lyme disease and also misdiagnosed because it looked like, let's say, a spider bite and never got worked up for it. And the big thing to me, one of the books I wrote was called Women in Lyme. And the reason I wrote about that was because oftentimes when you look at Lyme disease, most people have seen on average at least 7 to 9 doctors before they get diagnosed. So one of the really important pieces for me in like education when I'm teaching about Lyme to docs is that like I want you to be the first doctor. Like maybe you don't feel proficient in actually treating it, but to actually look at how to include that in your DDX and what to rule out and what to look for, because they do call it the great imitator. It overlaps with many different disease conditions, primarily like autoimmune conditions. And also people may or may not be familiar with the proper testing, the correct testing. It's still technically per CDC a clinical diagnosis. So I'll go through all of that in my talk, but I see patients throughout the country for it. So it's definitely in the area you guys are in, it's down south, it's, out west, there's different subspecies that may show up. And I think just education, there's still a lot more education that needs to be done in this realm.
Yeah, I agree. And it'll be really such a great piggyback off of our conference from last year when we had a 3-part series with Dr. Horowitz. So coming from your realm and being ground zero, but then also from a naturopathic end, I think this is going to be, I'm very, very excited for this talk in June. And yeah, I think it's just going to be such a great well-rounded sort of continuum of what we had last year. And if there's any more updates and things that you have, or it's just for me, I think another tool in the toolbox that you can give. And it sounds like you're going to give us some more tools that we can help with our patients in this realm.
Definitely. And we will go through some of the conventional treatments, but we'll also discuss how antibiotics can also how they also affect the gut microbiome for treatment, how they might affect things like increasing rates for like yeast and candida, what we're doing to offset that, especially patients that have been on antibiotics for a long period of time. And also as the naturopathic doctor and in functional medicine, we're always getting to the root cause, right? So we want to look at also like all of the other factors, hormones, and that's one of the reasons why that was important to me. Like hormones can help, you'll see the symptoms get worse or better if someone's going through perimenopause. You'll see menstruating women affected differently. You'll see women they'll have more, when you look at the stats, 83%, something like 83% that have like chronic Lyme symptoms are women. And there's more of sometimes mental health affects. If you look at some of the stats, even by serological testing, men are more likely for Lyme disease to show like 6 bands, and women are more likely to have like 4 bands, meaning they're often not producing enough antibodies to show. So even those different nuances, we're going to look at it like in a realm of even, immune function, hormones, or obviously herbal nutritional supplementation, and then also potentially the effects of antibiotics and like how we really manage all of that together as well. So it's going to be a lot to cover in a short period of time, but it'll at least leave you thinking of, approaches to care and actually being able to work up the case itself.
Well, that sounds great. Oh, well, thank you so much, Dr. Patterson, for your time today. And just want to encourage everyone that has not signed up that we are doing our conference in June 20 through 21st of 2025 in Asheville, North Carolina. It's called the Synergy Conference. And we just would love to see you out here and to see Dr. Patterson as well as some of the other speakers that we have for the conference. And so can't wait to see you. Thank you so much.
Looking forward to it.